today's topic is on communicating effectively with your medical provider. And I have a guest speaker who's been on the program before. Her name is Aileen Gerhardt, and she is an independent board-certified patient advocate. She is a certified senior advisor. She's the founder of Beacon Patient Solutions, LLC, and she's the founder of the Navigating Solo Network. So she's well-versed in many, many topics that has to do with patients, advocacy, and just really being there in your corner. Share with us how people can best communicate with their medical providers.
The reality is our healthcare system, as we know, is really complicated, and we have limited amount of time when we're interacting with our medical providers. And so because of that, preparing as much as we can will yield the most effective outcome for us. Mm-hmm. So I thought I'd share some slides along the way about, some tips and how to do that. And feel free to jump in with discussion questions, anything like that. And we'll go from there. So let me just go ahead and share. So we want to make sure that in the limited time we have with our providers, whether that's in person in an appointment or when we're trying to communicate via a phone call, via electronic healthcare portal, something like that, that we're as effective as possible. So to do that, we have to think of ourselves as an active partner. And so being an active partner, it's important to be prepared to ask questions and to be able to speak up, to advocate for ourselves whenever we can on something we may not understand or something we just need more information about. So it's really important to have those two things in mind as we approach our healthcare appointments. So I thought we would go over getting ready for an appointment, how to effectively share information, making decisions with your doctor, how to wrap up your appointment, and any follow-up you have afterwards. So usually I start off by asking people to write down everything they either ate or drank yesterday, including the portion size. And so the exercise is really to demonstrate we can't remember everything all the time. And so while we might remember some of the things we ate and drank yesterday, we may not remember it to the portion size, et cetera. And so because of that, it's really important to have some tools and a routine in order to prepare for and navigate our appointments. That's always an exercise that's worth doing because it illustrates, oh yeah, I can't remember everything that happened yesterday. That's just not something we as humans are able to do. So when we get ready for an appointment, the first thing we do is schedule an appointment. And we want to make sure that our health insurance is listed and anything related to the health insurance, whatever that is, private, Medicare, Medicaid, et cetera, that the details are listed so that you will have no complications regarding coverage. If you're in need of an additional person to help with interpreting, if you need someone to help you better understand whether that's for audio issues or English as a second language or an additional language, it's really important to ask ahead of time if an interpreter is available and to be able to arrange for that. Most offices will be able to do that, but they need to do it ahead of time often. Not always a resource that's right there in the office. And it's also important to, ahead of time, let the office know that you have an important question because doctor's appointments and other medical provider appointments are often scheduled in 20-minute, 40-minute, et cetera, blocks. And so if there's something you want to discuss with your provider for a longer period of time, you can be scheduled for a longer appointment So you're able to prepare and you know that will be covered, and the provider's office will be able to stay on schedule as well. So it's something to give thought to for everybody involved. So the other thing to do is really create a plan to make sure in that short amount of time that we often have in our appointments, and the time goes quickly no matter how much time we feel like we have. It's really important to list and prioritize the concerns you'd like to review during a healthcare provider appointment. And even though people don't always think of this as impacting one's health, it's important to list the other health and life changes that you might experience. There could be, unfortunately, a loss you're navigating. You could be moving. You could be recently have changed jobs or retired or started a new job or moved. All of those pieces affect our stress levels, affect our quality of life, etc. And so those parts are also really important to share with our medical providers. So it's good to make sure to note those as part of the list you're preparing. So here's the information that you should take with you. And sometimes people are surprised it's 2023. We're having this conversation via technology. We're able to beam it and have it on demand via a technological source. And yet I'm going to say, even in 2023, make sure the most important pieces of information are with you on paper. So, right, so we have all this technology and we can rely on it, and we often do. Sometimes it's cumbersome to navigate. But the reality is it doesn't all speak to each other at different healthcare providers' offices. And it's really important to have the most important information on paper. So what is that? Contact information for all of your doctors, their name, their phone number, perhaps city and state, a copy of your insurance cards. Again, private insurance, Medicare, supplemental insurance, Mass Health, Medicaid, et cetera, whatever applies. It's really important to have a copy of those cards with you. And your medical history does not mean everything since you were born, but it means the most major of the pieces of your history. So the things that you want to be able to cite quickly that have to do with a surgery or have to do with a treatment, important to be able to cite quickly and to have that on paper. And then an accurate medications list. So that includes prescriptions, over-the-counter medications, anything you take, vitamins, etc., supplements, and even eye drops. That eye drops also interact with other medications we might take, and so it's important to note those. And the medications list should be as accurate and comprehensive as possible. It's great that we know we take a pink pill, but it's even better to know we take medication for high blood pressure. And really even better to have that written down with the name of the medication, take it straight off the medication pill bottle, as well as the dosage and who prescribed that. And if you can write down why you were prescribed that, that's also helpful. But you want that list to be as accurate as possible so that either when you walk into a provider's office and you have to confirm medications, the list is already complete, or if you need to present it at any time during your appointment, it's also accurate as well. And I always encourage folks to keep this kind of information in some kind of file or binder that's easily accessible. These aren't the things we need to keep in our safe deposit boxes or hidden under the mattress. These are in pieces of information that we need to be able to access at our convenience, and possibly for others who might be helping us out in our support system who could also have access to that information. So the other things to think about during your doctor's appointment, or other clinician appointment is make sure to wear glasses and hearing aids if those are assistive devices you use. It's really, you want to see the best, hear the best, have the best, most effective interaction with your provider. And to be able to do that, you need to have all of the resources that make you the best you can be. Again, if you need an interpreter, make sure to ask for one. Everyone has the right to that. You should be able to interact with your clinician in a way that you understand the information, and of course, they understand you as well. And always consider bringing an advocate or having an advocate either on the phone or video chat. And when I refer to an advocate, that's just somebody else. It can be a family member, a friend, it can be a professional, but it's really someone serving as an additional eyes, ears. They might prompt you on a question you might have overlooked as part of your preparation. And again, if they can't be physically with you in the clinician's office or with you on the telehealth appointment, if that's an option as well, then you could have them on speakerphone or on video chat for them to be able to participate as well. It's always useful to have someone with you so that you can maximize understanding the information that's shared during your appointment. So once you've done all of that prep work, we have yet to walk into our clinician's office, right? So now we are in the office and we need to consider, how am I going to share information with my clinician during the visit? We've talked about the fact that time might be limited. We certainly, when we go to appointments, sometimes our stress or anxiety level can be raised. All of the preparation we've done, sometimes it's hard to maintain the best of our skills when we're not feeling at our best, if we're feeling anxious or stressed or even not feeling well. That all impacts how we then interact with our clinician. So what we do know is that clinicians have a limited amount of time for an office visit. And so it's really up to us as patients to set the agenda. So here's something that the National Institutes of Health put together, that you have about 18 seconds at the beginning of an appointment before the clinician dives in and interrupts that patient. It's not because they're rude at all. It's because they're trying to maintain a schedule, maximize seeing as many of their patients as possible, and effectively navigate your appointment. So if that's the case, we have to be really prepared for what we want to dive into. And so that's where that prioritizing is effective. And that's where we need to stay focused and be clear as well. So have a real sense of what we want to go over. You may remind your clinician of anything you discussed previously that you want to follow up on as well. So for me, the most important question to ask during a doctor's appointment or any other clinician appointment is a 3-letter word. And the word is why. So the reality is we tend to do things because it's either routine to do them, we might be told to do them, it might be suggested we do them, but there's usually a reason. So, for example, a clinician says, okay, I'd like to follow this up with blood work. Okay, why blood work? What are you looking for? The question of why not only keeps you engaged and curious, but also gives you more information and has you as an active partner as part of the conversation. So it's really important to keep why in mind, in addition to all the other questions we ask when we're speaking with our clinicians. So the Institute for Healthcare Improvement put together a really great resource. It's Ask These Three Questions, which is fairly quick and easy to do on their website. They have the Ask Me 3. The website is at the bottom corner of the screen. They have it in different languages, which is also really helpful as well. Right? What is my main problem? What do I need to do? And why is it important for me to do this? And so all of those pieces, those are some really great tools for us when we're asking questions of our clinician. This is because we're curious. This isn't because we're feeling adversarial, and it's not because we are trying to challenge our clinician in any way. It's truly that as a patient, we want to be able to make informed decisions. And we can't do that if we don't have all of the information that we need. So one tool that's used in a variety of different trainings, especially in med school, but certainly other industries as well, is the notion of repeating what you've heard. So you might find this happens in a clinician's office. You say, my knee hurts when I go like this, and your doctor says, okay, as I understand it, when you move your right knee like this, it hurts. They're doing that so that they can confirm that they have heard what you said, and that they understand it. And so it's a perfectly great tool for us to use as patients. So a clinician explains to us why they're recommending a certain medication, a certain lifestyle change, the possibility of a procedure. And so being able to say, okay, so here's the information as I understand it. Is that right? And let the clinician confirm that it is. Because you really want to be able to make an informed decision. And to do that, again, you need that information. So the other things that happen in an exam room, and I hear this from clients frequently now, especially as time is being juggled as part of an appointment, sometimes my clinician is sitting and looking at a computer, right? Because they're taking notes, they're reading notes, and they don't feel they may have that eye contact that they might be looking for with a clinician, that the patient may be missing that. So it's important to give some thought to positioning and nonverbal cues. When our clinician is standing up and we're sitting down, there's a power dynamic shift there. When they're in their street clothes and wearing an exam gown, for lack of a better phrase, we have a different dynamic going on. So it's important to keep those things in mind. It's really important to tell the truth. Often folks are asked either about alcohol use, smoking, any kind of drugs, or any other kind of behaviors. And the clinician is not asking because they're looking to spread gossip. They want to be able to treat their patient as comprehensively as possible. And to do that, they need all the information. So sharing the truthful things about meals, about other behaviors is really important. How often you exercise, how often you go for a walk, etc., trouble with driving. All of those things, you owe it to yourself to be as honest as possible. You'll have the best possible outcome with your clinician in telling the truth. It's also really important when we're preparing and making lists and thinking of questions that we're open to listen, to truly listen to what we're being told, so that we can make that informed decision. And the only way we can do that is by understanding the information that's shared with us. I always recommend to people that they take notes, and or if you bring someone with you or someone's on the phone, that they can take notes. And with a clinician's permission, that's really important, you can ask to record the conversation. Many of us walk around with a small computer in our pockets, right? Our cell phones. It has an audio record feature. You can record instructions a clinician has given you in terms of how to take a medication, why to take a medication, perhaps a new diagnosis, treatment options, anything you want to make sure you will get absolutely right in making the best decision for you. And the reality is, when we're in our clinician's office, we often feel very different than when we're sitting in our own living room. And so being able to take that information back home to somewhere that we feel comfortable, supported, nurtured, can really make a difference in how we hear that information. So again, it's a great tool to use, but you need to make sure you have that clinician's permission. You don't just randomly record people. That's not what I'm suggesting, but I am suggesting that as another tool for making sure we get our information correct. It's always good to start with symptoms if that's a priority for something that's going on for you. Things like, what are your symptoms, perhaps when they started. If you are having symptoms of something, keeping notes of when they start, what might trigger them, what makes them better or worse, and then the impact on your daily life. Does it prevent you from driving? Does it prevent you from wanting to go meet someone for coffee? Does it prevent you from taking your daily walk or able to walk your dog or any of those lifestyle pieces? Those are important to note as well. It's also important to review your medications. And if you do not know why you take a particular medication for what it might be treating, that's a good time to ask. Again, tell your doctor about your habits and be honest. You can also, again, share those lifestyle changes, retirement, new job, move, loss of a family member, friend, pet, partner, change in having a partner or not. Any of that affects our health, and any other concerns you might be thinking about are also very important to consider. So ideally, a conversation with our clinician looks like this. We share our concern. Doctor asks us some questions about symptoms. You answer the questions. The doctor shares some ideas about possible diagnosis and treatment options. You're able to ask follow-up questions to better understand. Your clinician then answers those questions. If anywhere along that process you don't feel you understand, you repeat the process until you do. That's the ideal. The reality is our clinicians want us to understand our diagnoses, our treatment options, everything about our health, not only because that's why they chose to go into this field, but because the reality is the more we understand during our appointment, the less chance there is we will need to follow up with a call to the office, with a possible email through the electronic portal and health record system, if that's something people are using. So knowing that information is effective and maximizes everyone's time and gives you as the patient the best possible outcome. So when a medical test is ordered, it's, there are all kinds of questions you can ask. Why is it important for me to take this, test? What's it going to tell us or show us? How do I prepare for it? How might it feel? Are there any dangers or side effects? Now, you can, at this point, look up anything on the internet and find any unreliable piece of information about anything. That is not my recommendation. My recommendation is to have reliable information, and the first person we can ask for that reliable information is our clinician. So either the individual can answer that question, or they can provide you with websites or pamphlets of different places to go to read about perhaps a procedure, a test, etc., so you'd better understand the information. Cost is always important. While your clinician may not literally know the cost sitting in the exam room, the people who work on billing and work with insurance in their office does. So you are able to speak with them. And if it's at a hospital system, there is a transparency law that is in effect where you look for something called a charge master. And that has a list of all of the different costs of procedures, et cetera, at that facility. That's a facility piece. Cost of healthcare is a whole nother conversation and a whole nother episode. But just know that that information is available to you and should be available to you. And you can also call your insurance company to find out what the co-payment cost may be, out-of-pocket cost may be to you as well.
Eileen, before you move forward, can you so when a person is if they're told, okay, there's something going on with their medical condition, I'd like for you to go for a test, and the patient might be concerned, okay, how much is that going to charge? How much is that going to cost? Will I be able to afford it? Who at that point should they ask how much it would be? Would it be the doctor's receptionist or secretary? Will they be able to connect you with a person to talk to, or how does that work?
So often each medical practice have folks who are working on billing. Either they're submitting the medical codes a clinician writes down for the various things that happen in an exam, or they are working with the billing department for the practice. Those folks can access information about what the cost would be. And the other place you can always get that information is by calling your insurance. Again, private insurance, Medicare, Medicaid, in Massachusetts, Mass Health, which is Medicaid. All of those places you can either call or look online for cost estimators, and you're able to find that information. Depending on what the test is or the procedure is, there is a cost for where the test or procedure takes place and who also administers that. So there's often a facility fee and there's a clinician's fee. But the most basic way to find that information without everyone watching this going, oh my God, I don't know how to do that, right? And even more stress inducing, which we don't want, is to either utilize the insurance company's website and look for a cost estimator, or call the insurance company and do the same thing. Ask for an estimate of costs. If for some reason the insurance company can't pinpoint what it is, you can call the clinician's office or while you're there and ask for the code that will be put in for that particular test. They're 5-digit codes. And that will help the insurance company look it up for you as well.
Wow. Okay.
Definitely a fun conversation for another episode, right? Figuring out and navigating healthcare costs.
Definitely.
Yes. But that's really important. The other piece is to understand how and when you will get the results. So one of the things that drives me absolutely bonkers is when I hear from a client that a doctor's office has called and said, we got your blood work back, it looks good. So let's go back to that whole why, right? Why did you send me for that? it looks good tells me nothing. And so, one, we want to know the actual information when we use our electronic portals, if we do, and our electronic healthcare records, things like MyChart and other resources. They have different names. They have the same function. Sometimes we get the results back earlier than we might from a clinician. We shouldn't self-diagnose at all. But you want to be able to understand those results. So when the clinician tells you, please go for blood work, please go for a stress test, when those results come back, you can say to the clinician at the time, okay, so when those results come back, who will I be hearing from about them? Will it be you? Will you give me a call? Are you send me a note through the electronic portal? How will I understand those results? Your blood work looks good does not tell you anything because they sent you for that blood work for a reason. So it's important to understand and be able to keep your own records as well, so that when and how I'll get results and understand those is equally important. Similar things with diagnoses. So what may have caused the condition? In some cases, there are things that are preventable going forward. How long it might last? Is it short-term, long-term? How can this condition be treated or managed? And how will it affect me? Which is a question we don't always ask, but is really important. So a particular condition may have a couple of treatment options. One, again, prevents you from driving, prevents you from walking your dog, taking a daily walk, etc. And another may not. If they are equal in treatment, you may want to consider the different options related to how it impacts your life. Am I able to go pick up my kids? Am I able to take my kid to an activity? Am I able to assist somebody I'm caregiving for? All of those pieces do not sound like something that that is instinctual to consider as part of our medical navigation. But the reality is they're really important because they affect our quality of life. And our quality of life, one, should be as maximized as possible, and two, also affects our health. So we want to be set up for the best possible outcome. So it's good to give thought to that as well. And I included a couple of different times on various, right? So treatment options, same thing. Treatment options are called options because there should be more than one. We are supposed to be in an ideal setting for navigating our healthcare. We are supposed to be given options, whether that's two different medications that may treat the same condition, or two different types of treatments or care plans for particular diagnoses. It's good to think about what are the options and choices. I had a client who said, I had a particular diagnosis. One clinician suggested one kind of treatment, which was non-invasive, and the other, which was completely invasive. And I didn't know how to figure out which one was right for me. So how do you do that? Who do you talk to? You are entitled to a third opinion as well. That can sometimes help with a situation like that. What are the risks and benefits of the treatment options? What will it do? What are we hoping it will do? How long will it last? Do I need help, right? Am I going to need to be assisted coming home from the treatment or back and forth, et cetera? Is it covered by my insurance? Again, back to the what is the cost? You can have an estimate ahead of time. And back to that, how will it affect me? Ask yourself, what is the best treatment choice for me, given my values and circumstances? And values and circumstances and how it will affect me is not usually how we think about navigating healthcare. But the reality is we are deserving of that as considerations. And what we choose often affects our support systems, our partners, our family members, our extended family members, friends, work, all of those different pieces. And so ideally, we would like to be able to include how something affects my values, how it affects my current circumstance going forward. So it's a question that I try and include on all of these different pieces, in addition to what will it cost me, how is it covered by my insurance, et cetera, because it's, to me, an equal question as well.
Yeah.
So we finally, after all of that homework and all of that hard work and all of that listening, we've gotten to the end of our appointment, and the checklist of things to do, I suggest sharing your point of view. Oh, this sounds realistic. Oh, I know you suggested this. I just don't see myself taking this on. Is there an option? That kind of thing. Clarifying next steps. Okay, so we talked about adjusting a behavior, a lifestyle, making a lifestyle change. And then in 6 months, we're going to look at blood pressure again. Is that your suggestion? Yes, no, from the clinician, and understanding what next steps might be. Same thing with goals. Discussing contact information for the doctor. Yes, the phone number is available. Sometimes they have websites. Often they suggest communicating with them via an electronic portal. It's not very common that people text with their clinician or even email with them. But it's also important to know what their process is for communicating. If you call the office with a question, when can you expect to hear back? How can you expect to hear back? There are a number of clinicians who say, well, I would love to give you a call back. I can write to 5 patients in the same time I would make that phone call. And so because of that, I prefer to use our electronic health records portal to communicate on a question. So you can look out for that. If a patient then says, I don't use that, then that's important for the clinician to know as well, because then that patient won't see the communication from the clinician, and that's not effective for anyone. So it's important to know what the clinician's process is, so that you can best adjust your expectations, know when to follow up, and just have a sense of how you'll be communicated with. That's important. And again, if you're somebody who does not use the portal system, and there are plenty of people who do not, and there are plenty of clinicians still who are not, then you want to know what method you'll hear back from that clinician. As I referred to, we can look up anything on the internet now that doesn't necessarily make it true or real, or certainly reliable, especially when it comes to medical information. So one thing you can ask a clinician is, what are your recommendations for reliable sources to learn more about whatever the condition is that we discussed during our appointment? As you may have seen, with my slides, I utilized resources from the National Institutes of Health. The abbreviation is NIH. All of that information is reliable. You can't go wrong. Tufts Medical Center, other care facilities in the area all have excellent resources on their websites to best understand the diagnoses and conditions. So it's really important to use reliable sources so that you get the most accurate information to best understand a diagnosis. And your clinician's office, whether that's directly with the clinician, possibly a nurse practitioner in the office, or some other administrator, can provide that information for you. So there's still homework after we're finished with after our appointment. I recommend that everyone review and file the notes and test results in whatever file system you're using. Yes, it's available online if that's a tool you use, but it's not always accessible every place you go. The systems don't all speak to each other. It's also really important to review your notes from an appointment after the clinician writes them, because in error, they may have included something that isn't a part of your diagnoses or isn't a part of your health treatment. And that can follow you as you go to other clinicians and specialists, and you might be suggested a treatment plan based on information that may not be correct. So it is really important to review what's in your record. Every healthcare system has a way to amend your notes, to make changes to your notes. It's a little bit of a cumbersome process, but it is worth it to have the accurate information as you continue on navigating your healthcare. It's important to schedule any recommended follow-up appointments. Make sure you pick up any new prescriptions that are ordered. If you're somebody who uses an online portal, make sure to read those. Often you get a notification that your clinician has submitted notes. They're sometimes different than the synopsis that usually appears almost immediately after your appointment. And make sure that you have identified resources to make informed decisions related to a diagnosis or treatment. And again, I recommend keeping those pieces of information in some kind of file system, a healthcare binder, etc. The National Institutes on Aging, which is a part of the National Institutes on Health, has an outstanding book, a booklet called Talking with Your Doctor. It's a guide for older adults. It's available for download online. And also, one of the things I think is outstanding about the NIH is that they have a huge array, a large variety of publications on all different topics in multiple languages, available to have mailed to your home, to your office, wherever, as a resource. So in the immediate sense on this subject, I really recommend the Talking with Your Doctor book, to have it, on a bookcase, on a shelf, in a file. It's really a great resource. So I always like to make sure to let people know about that. And again, a very reliable source for all kinds of information. So those are my suggestions.
It's very comprehensive, and it really, the way you put it in the beginning, how your time with your clinician is limited. So do your homework, be prepared so that your time together is spent in a way that's going to help you best take care of yourself, or help the clinician be able to really put together all the information that they need to be able to create the best treatment plan. So I love that, because not too many people are in that space, or maybe they don't remember to, get things prepared before their doctor's appointment. So
it's really hard, especially if you don't feel well, right? There are routine appointments. We go for an annual checkup. We go for something scheduled. But if you're somebody not feeling well, you are not at your best. You just want to feel better. You could be the most methodical, plan-oriented individual. But when you feel icky, all of that goes out the window for everyone. And so being able to rely on some kind of already put in place system, having someone come with you, have someone listen, all of those pieces, if they're not able to be with you to listen, means that hopefully you can, as you pointed out, maximize that experience. You can also eliminate some speed bumps. If communicating in a language with your clinician is not as easy for you as you would like, then putting steps in place so that you get the care you deserve is really important. It does take some pre-work, but it is really valuable to do.
Mm-hmm. Yeah. Well, I do a lot of work, creating workshops for older adults, and also, I've shared this on the program that my parents are aging, and so I want to make sure that when they go to their doctor's appointment, that myself or one of my sisters are with them because of the hearing impairment. And also, depending on who we are walking with or taking to the doctors, one parent is, more independent than the other. So there's so many different factors to keep in mind. But, the gist of it is making sure that you can see and hear when you're at the doctor's appointment, you are best prepared and what to do afterwards, right? Right.
Because that maximizes your experience. I always say, we can't change the science, unfortunately, right? We can't change what's happening inside, but we can figure out how we're going to navigate that. Should we receive a diagnosis? What's our plan for understanding it? Whether that's with the clinician we met with, an additional resource, et cetera. And so another benefit of going to an appointment with an older adult, sometimes if people are having a hard time communicating with the clinician, not intentionally, but might look right through that individual or decide that individual might have an impairment that they do not have, just because of a communication struggle. So we are able, by accompanying our friends, our family members, et cetera, to appointments, we're able to serve as that advocate, as that prompt, as that, oh, right, you wanted to ask this question. Oh, right, again, we're human. It's hard to remember all those things. It's really hard to remember them in those gowns where you tie them in the back. Right? You're not in your comfort zone. And not being in our comfort zone shakes up our skill set. So anything we can do to be prepared, knowing that's going to happen, right? People talk about white coat syndrome, right? That's a very common, right? The notion that, a clinician's wearing a white coat and we kind of go, our nervous system kind of goes, oh my goodness, I'm so stressed, right? There's also something that often happens in a clinician's office if you're not prepared, and that's something called the doorknob question. Are you familiar with the doorknob question?
Is that as the doctor is leaving, a whole slew of questions starts coming?
Right. So what happens, right? The clinician is scheduled in a way where they want to answer the question for their patient because they want them to have the best possible outcome. That's why they went to medical school. That's why they chose to be a clinician or whatever schooling they went to. They want the best possible outcome for their patient. But they have another 3 patients sitting in exam rooms all the way down the hall. So to try and prepare as much as possible, we can then avoid the experience of the doorknob question, because we're not going to get the best answer at that time, and the clinician is not going to be able to answer in a way they would like. It's not a benefit to anyone. So it's good to try and avoid it. It's worth a chuckle too, but it's often referred to as the doorknob question.
Oh yeah. I definitely have seen that.
And everyone's experienced that. Every clinician has, every patient has. But to be the most effective, we, at that point, it's, nice to see you in 6 months, right? That's really the ideal doorknob conversation. And yes, you can get dressed now. Those are usually the pieces, right? So it's always, good to know that as well.
Yeah. And also, depending on the specialty of the clinician you're going to see. If you're seeing, for example, an orthopedic doctor, you don't really necessarily need to start asking questions about the mole they have in the back of your, or maybe the fact that, you feel like your blood pressure has been running low or high. I mean, they might take your blood pressure, but that's a conversation with another
specialist.
Yeah.
Right. The other thing that used to happen for years, and we know the healthcare system has changed, people were seen by their general practitioner, which now is a primary care physician, an internist, a family doctor, right? And so people would spend the first 15 minutes, how are you? How's your wife or husband? How's your kid? Right? And they'd ask the patient, how are you? How old are your grandkids now? That's 10 or 15 minutes. One, we don't have that same continuity of care, unfortunately, anymore. People aren't necessarily treating people and then treating their children and their grandchildren. But in addition, when time is limited, even though we want to engage in those pleasantries because they truly care about us and we truly care about them, our time is limited. And so we have to prioritize as well.
That's a very good point. Very good. Yeah, a lot of those type of conversation happens from the waiting room into down the hallway.
Right.
So how have you been?
Exactly. And the reminder, again, if you just remember that the people who work in the healthcare system decided to go into the healthcare system because they want to help other people. The structure of the system makes it harder. And so what we can do as patients is better understand the unfortunate complexities of the system and how to benefit, how to have the maximum benefits for us, which only in turn helps our clinicians, but first and foremost, makes our experience the most effective it can be.
Now I have a question. Are there clinics out there who, as the patient checks in for their appointment, do they provide some sort of like a piece of paper or a card that basically asks maybe one question, what are you hoping to share or talk with your doctor today?
No, no. Like often people are handed, please confirm your medication list, right? Sometimes you're confirming your address, your insurance, your blah, blah, blah. But the getting a jump on the appointment and truly understanding what brought you in today is not something that people have thought about as part of that intake in coming into the office. It's an excellent idea and a model that would surely benefit everyone, right? It would benefit everyone. But that's not something that has, to my knowledge, really been incorporated. It might be in integrated healthcare practices where people see, where they look at it from a holistic perspective and all different clinicians with all different specialties are part of one practice. That may be a model that people are moving towards. What's interesting about that is we have the concept in our healthcare system of patient-centered care, right? That we are the absolute center of the circle and everybody spokes off of us, right? So that fits that model. How it's being implemented, if it's being implemented, is an excellent question.
When you were talking about what to do after your appointment or, at the conclusion of your appointment, do you usually encourage people to ask for an end of visit summary? So
you can have one printed out and or once the clinician has actually filed their notes, because the end of visit summary sometimes is ready before we even walk into the exam room sometimes. But that is an excellent best practice in terms of when you leave, ask for a printout of that. Ask for a printout of anything you've discussed that the clinician has already put in the computer system is really helpful for making sure your files are accurate and gives you a chance to review it to make sure there are no errors, which is also really important.
You mentioned MyChart. So Tufts Medical Center does use MyChart. Since COVID, it's been so difficult to make appointments with the doctors, and the healthcare professionals are really struggling and doing their best because of short staffing or just seeing sicker patients. So MyChart is really a great way to ask a quick question to, maybe the nurse practitioner or the PA or the doctor.
Nurse practitioners and physicians assistants, PAs, are excellent resources that are often underutilized, right? I talk about pharmacists as also being underutilized. You have a question about a medication, a pharmacist either working for your insurance company or at your local pharmacy, outstanding resource. Same thing with a nurse practitioner and with a physician's assistant, a PA. Often their schedules have a little more time than an overscheduled MD or DO. And so it's also great to think about those folks as excellent resources. So that's a great suggestion. We also, unfortunately, have a shortage of people going into general medicine. And so in addition to, we have a shortage of a lot of things, but the field of general medicine, of somebody being an internist, someone being a primary care physician, there are fewer people in medical school choosing that as their specialty, as their path. And so nurse practitioners and PAs are an excellent resource when you're thinking about primary care as well, for many of the reasons we just talked about. But it's just important to also think about that. It's not as easy now to change primary care physicians. There aren't as many choices, et cetera. So knowing the system, knowing the alphabet soup of clinicians is really hard, is also really important as well. And for me, as an independent patient advocate, I always talk about that. I don't make widgets. My product is information. My job is to work with my clients and do community education programs that offer people the tools to access reliable information so that they can make informed decisions for themselves. And the rest of that sentence usually involves that reflect their values and circumstances. That's what I do, helping people navigate those complexities. So programs like this, and give people the opportunity to access the information they need to make informed decisions. I'm grateful that Tufts Medical Center is and you are committed to offering this series and really providing excellent community education for folks.
In the beginning, you said, empowering the people to ask the 3-letter word, the why. Right. So, providing these type of information out there that's really accessible to, the older adults gives them that, pause or the permission to ask, why.
I always say to people and always encourage people and remind them, you can be assertive, please don't be aggressive. But that why question isn't adversarial. We're not challenging the doctor or second guessing the clinician. We want to understand for ourselves to make that decision. And sometimes generationally, that's a hard thing to shake up. When someone else went to medical school, nursing school, PA school, whatever, and they're standing there in a white coat and we're not, right? But we're an expert on us. I live with me 24 hours a day. I know me pretty well, fairly well, right? So I can rely on partnering with a clinician who knows their information, and together, hopefully we can make an informed decision for me.
Yep. Thank you for being with us today, sharing us really important information about how to effectively communicate with our medical providers. And I want to thank the Quincy Health Department, who continues to collaborate and really sponsor all the programs that I do out in the Quincy area and the South Shore areas. Thank you so much to QATV. Be well and be safe, everybody. Take care.